There are tough new measures against Ebola in New York and New Jersey. It's to combat the Ebola virus. Authorities there will be forcing anyone returning from West Africa to remain isolated for 3 weeks. But it's controversial, with critics saying the measures do more harm than good. Arthi Pol reports.
Taking no chances. As soon as news broke of a new Ebola case, cleanup crews were dispatched to several areas where the patient visited in the days prior to his diagnosis. No spot overlooked.
Everything is going to be steam cleaned, disinfected. We're going to take it as if it was Ebola-containing material everywhere.
Dr. Craig Spencer returned this month from Guinea, where he worked to treat Ebola patients. Prior to testing positive, he visited popular tourist destinations in New York and used the subway. At least 3 people he was in contact with are now in quarantine as he undergoes treatment at this New York hospital. And last night, another health worker returning from Sierra Leone was also quarantined in New Jersey. She wasn't showing symptoms but did develop a fever while in hospital. Officials in New York, New Jersey, and Illinois are now demanding a mandatory 21-day quarantine for anyone who has come in contact with potential Ebola patients in West Africa.
We have to do more. It's too serious a situation to leave it to the honor system of compliance.
We are no longer relying on CDC standards. There are now New York, New Jersey standards.
Today, the healthcare worker in New Jersey tested negative for the virus, but she remains in isolation. Meanwhile, nurse Nina Pham, who treated America's first Ebola patient, is back in Dallas after being cured of the virus and meeting with the U.S. president.
Patients can beat this disease, and we can beat this disease, but we have to stay vigilant.
But some experts say perhaps too much vigilance could impede efforts to contain the current outbreak in West Africa, criticizing the stricter measures in New York, New Jersey, and Illinois.
If you see other doctors returning and facing a lot of criticism or stigma, it's going to have an impact on thinking about going somewhere like that to help out.
Already in Monrovia, a clinic was forced to close because there's not enough protective equipment available to staff. She asks, what are you expected to do now? Treat yourself at home and hope you don't die? Now another African country has recorded its first Ebola case and death. A 2-year-old girl in Mali. She'd traveled to the country from Guinea on a public bus with her grandmother. Now more than 40 people are in quarantine and hundreds more may be at risk in a country that had thus far managed to evade the outbreak.